Most people care about their community, but it's how we interact, how we share common values, resources, needs, and risks that build a strong, safe, and healthy community that allows people to prosper and live a life with purpose.
It's hard to live in a community this size without knowing where you feel like you know everyone. Where when you go to the grocery store, there are your friends, there's the kids you've coached, there's the people you've grown up with, and I think all of us want to see everyone flourish in this world. I think we all want to see that health, and we all want to have an ownership in the health of our own community. There's probably nothing that can debase or damage a community as much as substance abuse and alcoholism.
In Placer and Nevada counties, substance abuse and the mental health issues that co-occur have not only reached a crisis, but have put the health and safety of our communities in jeopardy.
When you deal with the human loss, the toll on families and communities, it is a crisis. We're not going to be able to incarcerate our way out of a problem. And that's been the mindset. That's what we've done. We've been tough on crime. With realignment, we've got to become smart on crime. And part of it is going to be to take a look at the facilities, the resources available through community-based organizations, treatment.
Fortunately, there is a solution for treating substance abuse in Sierra Nevada communities. It's an innovative solution that's been in development for some time, and now it's ready to be the solution that works. Community Recovery Resources began in 1974 as a way to bring mandated DUI classes to Sierra Nevada communities. But for so many in those classes, drunk driving was just the tip of the iceberg.
Individuals were being mandated to our program for education and counseling. And what we were finding out is that the problem went much deeper than a one or two incidences. What we were seeing was something that was lifelong, it was hereditary, it reached out into the community through their families for generations, and we needed to develop a response.
By the late 90s, CORE had expanded into other Sierra Nevada communities, and services grew with substance abuse treatment for adults and adolescents, family therapy and outreach services, programs aimed at helping more of those who had fallen through the cracks of traditional health care.
What we have proven is assertive community treatment works. And having community-based organizations be a part of the change that those individuals need is what keeps them out of jails and keeps them out of robbing our homes and businesses, and really can turn them into productive citizens.
By 2005, substance abuse had risen to epidemic proportions.
I'm a drug addict, I'm an alcoholic. So when I take a substance into my body that most people take, it affects me differently. My body, my brain wants more.
In Nevada County, a grand jury report made it official. Drug abuse, especially methamphetamine addiction, was destroying Sierra Nevada communities. Costs to communities were escalating, families were being torn apart, and overall health and safety was spiraling downward.
In the courts, we knew the magnitude of the problem, and we had been so frustrated about our inability to respond in a meaningful way because of generally a lack of resources. CORE really stepped up because what they said is, we understand this problem. We understand co-occurring disorders. We are ready, willing, and able to do whatever we can to address those kinds of problems.
All I've ever wanted to do is be a productive member of society, work an honorable job, and give something back. And I lost that, and they've helped me get that back.
Today, CORE provides the majority of treatment and prevention services in Sierra Nevada communities, from Kings Beach to Grass Valley to Roseville.
She does have a case manager, but we need to really increase her therapeutic time.
The approach is interdisciplinary. Treatment professionals oversee a diversity of programs,
Is the child exhibiting any?
both outpatient and residential, tailored to the individual, financed through a variety of revenue streams, and overseen by treatment supervisors and medical teams.
We're creating a new system and a new approach and a new organization to optimize the treatment, but then to optimize recovery and sustained recovery, and then having that individual contribute back to society and the community. And I think this is why Placer and Nevada County were so excited about what we're offering.
There's a delicate chemistry that ties people to family and families to a community. Recovery is successful when a core client can build a sense of identity, improve their physical and mental health, develop healthy relationships, and, in the process, find a meaningful purpose for their life.
When substance abuse took over my life, it just dragged me to the ground. Destroyed all my coping skills, my parenting skills. My kids were taken. My mom didn't want anything to do with me. Today, I've gained those parenting skills back. I've learned coping skills. I have a relationship with my mom. I have my children back in my lives today, and I can communicate on a positive level with their father so we can co-parent as a team.
When I saw that campus, I was so impressed with the thought that had gone into it and the detail that had gone into it. There's going to be people there to help. There are so many different programs there that are going to help people. To be able to have their families involved on the same campus is absolutely extraordinarily wonderful.
It's summer of 2012, and it's almost ready. This is a campus that is bringing recovery to Main Street. In these session rooms, clinics, and dorm rooms, CORE will provide a full spectrum of therapeutic programs. This is where 2,000 people a year will recover from substance abuse and other related behavioral health issues.
I've always felt that I lived in a wonderful place, but when communities come together like ours have, it makes me even feel better to think that we are the first facility of this kind in the country is just awesome, and that we have a chance to really make a difference for our citizens who are struggling with these issues.
This Community Recovery Resources Campus is where addicts can become independent, where men, women, and their families will become productive citizens, and the stigma of recovery will no longer block their future.
The largest mental health facility in this country today is the LA Sheriff's Department. That's not where you treat mental health. That's not where you treat substance abuse. It's in community facilities where people are surrounded by people who care for them, who love them, who want their lives to be different, offered up in a dignified manner. And I think we'll be surprised by the things that this particular facility is going to generate for this community. There'll be models and messages and a sense of hope for us all.
Community Recovery Resources has a vision for healthy and drug-free Sierra Nevada communities. After years in development, an innovative solution is ready. Now the community must help fund the initial cost for building the campus. But the dividends are huge, and the returns will be paid in the form of community health, safety, and pride.
There is no disputing the need for this campus. The question is, how are you and I and this community going to respond to this need? When I used to talk to jurors when I was an active judge, I used to say, you know, jury service is the highest public form of civic duty that a citizen can do in time of peace. And now I say to you that the reduction or elimination of suffering is the highest private form of duty that any citizen can do in our lifetime. I ask you to join me to support this campus in that mission.